My name is Mariah.
I'm Leslie.
And this is Laura. And we are here to educate you today on how to take care of a family member if they were to have a seizure.
So what seizures are bursts of electrical activity in the brain that temporarily affects how it works. This can cause changes in sensation, consciousness, and body movements. According to Teakin et al. 2022, seizures are among the most common neurological emergencies encountered in children. It has been reported that 4 to 10% of children have a non-triggered seizure up to the age of 16.
There are several types of seizures, and these are just a few of them. An absent seizure is when it looks like someone is staring off into space for about 15 seconds, and they are unfamiliar of their surroundings during that time. Partial seizures are when one part of the body is involved. Generalized tonic-clonic seizures are also sometimes called grand mal seizures. They involve the stiffening and jerking movements, and the person loses consciousness. For tonic seizures, it uses lots of muscle tone, and they can potentially fall, which is why sometimes you will see them wear helmets. Status epilepticus is when a seizure lasts more than 5 minutes. This is considered an emergency situation, and you should call 911. To diagnose seizures, there are several labs and tests used to diagnose them, such as a CT scan, an MRI, and an EEG. And for labs, they will look at electrolytes, specifically sodium, since it is related to neurological issues. And they will also look at a CBC, a BMP, and a CMP. Sometimes a lumbar puncture may also be performed to analyze the cerebrospinal fluid that surrounds the brain and the spinal cord. This can help rule out infections like meningitis or other neurological conditions that could cause the seizures.
Here are some risk factors for seizures. Brain injuries, head traumas, tumors, and infections can increase pressure inside the skull, which can squeeze the brain and lead to seizures. High fevers can cause what are called febrile seizures. This happens when the body's temperature rises quickly, throwing off normal brain activity and triggering a seizure. Stress and not getting enough sleep can mess with the brain's electrical activity, causing unusual discharges that might trigger a seizure. Sodium and magnesium play a role in sending and receiving electrical signals in the brain. If sodium and magnesium levels drop too low, it can mess with how neurons work, which make seizures more likely to happen. According to Yang et al., new generation antidepressants can increase the risk for seizures in short-term use. Other risk factors include brain damage, genetic, brain infections, and alcohol and drug use.
For treatment of seizures, there are anticonvulsants, anti-epileptics, and then also surgery. Anticonvulsants are used to stop seizures. Some examples are lorazepam or diazepam, which are benzodiazepines that have anticonvulsant properties, and Ativan and Valium. Anti-epileptics prevent seizures and are taken daily. Some people may also take both anticonvulsants and anti-epileptics to prevent or limit the amount or frequency of seizures. For some, surgery is an option where they implant a device in your chest that has wires leading up to the brain for a deep brain stimulator to decrease the specific type of seizures.
One of the medications used to prevent seizures is lamotrigine, and that is a triazine anticonvulsant which decreases the incidence of grand mal seizures in both adults and children. Common side effects of this medication are nausea, vomiting, and headache. So this medication should be taken daily with or without food and should not be broken, crushed, or chewed if taking the extended release version. It's also important to report any rash, fever, or swollen lymph nodes to your provider. Phenytoin is another anti-epileptic medication that is used for the prevention of tonic-clonic seizures and focal seizures. Side effects of this medication are agitation, rash, and hypotension. This medication should be taken with or after meals to minimize GI irritation. Liquid preparation should be shaken well before taking. If you're a diabetic, blood glucose levels should be checked more frequently. You should not take this medication 2 to 3 hours before or after antacids. Another medication used to stop an ongoing seizure is diazepam, which is a benzodiazepine that slows down the nervous system. Routes of administration for this medication are intranasally, rectally, and through IV. Common side effects are drowsiness, confusion, and double vision. It's important to avoid drinking alcohol or taking other CNS depressants such as antidepressants, sleeping medications, and opioids. You should avoid driving or any other activity that requires you to be alert. This medication is useful to have on hand if your family member experiences seizures. When giving it nasally to your family member, you need to insert the tip of the nozzle into one nostril until your fingers are up against the person's nose. Press the bottom of the plunger firmly with your thumb to give the diazepam, and then throw the nasal spray device away after use.
Here is some important teaching about taking care of a family member with seizures. Ensure medications are taken as directed every day to decrease the risk of seizure activity. In cases of emergency, your family members should wear a medical bracelet to alert others of the seizure disorder. Ensure their stress levels are low and that they are sleeping an adequate amount every night. It is important that they prevent any activities that increase intracranial pressure, such as coughing, sneezing, bending at the waist, lifting objects over 25 pounds. They should avoid laying down flat, straining when using the bathroom, and highly intensive exercises. In the event of a seizure, lay them down on the floor and place them on their side. Ensure to cushion their head to prevent any injuries. Ensure that their surroundings are free of any objects that may cause any harm. Do not place anything in their mouth as it can cause an injury to them. Time the start of the seizure, and if the seizure lasts more than 5 minutes, call 911 immediately.
And then here are our references, and thank you for watching.